The pandemic crisis has put a lot of pressure on the health system. Many people complain that they have problems after COVID infection.
I am so grateful that you talk about long COVID. We don't talk enough about it, bravo, because we know from our studies that in our region, 50 countries, about 17 million people developed long COVID in the first 2 years. And in the beginning, we didn't know what it was. People were not taking seriously. So we need to develop for those people psychosocial support, because strong people who all of a sudden cannot get out of their seat or their bed in the morning to do a normal walk, this really impacts your mental health. They need to get unemployment benefits, sick leave, and much more research. When I had COVID after 2 years, although I was very strict, but ultimately the Omicron, I got it, for the first time in my life, I was so-called lazy. Because doctors told me, force yourself, Dr. Kluge, to take 10 days rest even after the symptoms to avoid the long COVID. So people, please take your vaccines, your booster. If you have COVID, take it very seriously. Take the rest, because this long COVID can be very, very debilitating.
Is this pandemic over?
The pandemic is not over. Last week alone, 1,500 people died in our region. We shouldn't have died, but of course the situation is much better. I am confident that this will be the year that we can call the pandemic over, but people should learn the lessons on the vaccination. If you have a certain disease and you have someone coughing, not necessarily COVID-19, but maybe a flu, put on the mask if it's in a very crowded area that you cannot escape. Keep healthy lifestyle, and for the country very important is what we call surveillance. So if a certain virus pumps up, that very quickly this is being detected, and this can be easily done in the wastewater.